You're going to start to feel a little bit of that relaxation medicine, okay?
Now more than ever, healthcare professionals feel connected.
You doing okay?
Standing in solidarity.
In through your nose and out through your mouth.
To do whatever they can to ease the burden of medical heroes around the country.
The first thing that went through my mind was I need to make sure that my staff is prepared.
Dr. Paul Kashgarian is a San Diego oral surgeon. When the American Dental Association called for dentists to postpone elective procedures, he knew his doors would stay open.
Patients that have toothaches or dental infections that don't have a dentist of record, oftentimes they find themselves in the emergency room. It can overwhelm an emergency room, quite quickly.
The American Dental Association estimates there's a dental-related emergency room visit every 15 seconds. A major concern now as hospital beds and protective gear around the country are in short supply.
This is a war zone. It's a medical war zone. Every day I come in, what I see on a daily basis is pain, despair, suffering.
This Brooklyn hospital is inundated with COVID-19 patients. Whether in New York or where Kashgarian practices in San Diego, emergency rooms aren't often equipped to handle dental emergencies.
It was just kind of overnight, woke up and couldn't really open my mouth as much as, you need to eat and that kind of thing. So biting a sandwich was even a little bit difficult.
Rather than going to the hospital, this patient called her dentist who referred her here. Many oral surgeons around the country remain open to help these patients.
If you don't like the shade of your tooth, that's one thing. But, if you aren't sleeping well at night, if you have pain, if you have swelling, those are things that need to be dealt with because oftentimes dental emergencies can become more severe quite quickly.
While they screen patients for COVID-19 symptoms, these doctors are inherently at risk working inside a patient's mouth. But they say it's a sacrifice worth making so their medical colleagues in hospitals won't have to see these patients too. Amanda Brandeis, 10 News.